Against a backdrop of rising concern about the resurgence of the H1N1 swine flu this fall, a government advisory committee today decided who should be the first to get a vaccine. At the front of the line are people who are most vulnerable to the disease. Pregnant mothers and healthcare workers are at the top of the list. But supplies will be limited, and the first doses will be dispensed later in the flu season than health officials had hoped. Lisa Stark has more now from the Centers for Disease Control in Atlanta. Good evening, Lisa.
Good evening, Elizabeth. Well, committee members today wrestled over which group should have top priority for this new pandemic flu vaccine. Ultimately, they decided to paint a broad brush. First and foremost, immunizations will go to those at highest risk from H1N1 swine flu. Not just pregnant women, 15 of whom have died from this virus, and healthcare workers, also those who care for young infants, children and teens 6 months to age 18, and those 19 to 64 with health problems such as asthma and diabetes. In a surprise move, the committee added healthy college-age kids to the list, deciding 19 to 24-year-olds should get priority too, because they frequently study and live in close quarters and often spread the virus. This list covers nearly 160 million people, over half the U.S. population.
We know we can't eliminate it. We know we can't protect everyone, but we're hoping to minimize the number of hospitalizations and deaths that occur from this pandemic.
Only after these groups would the vaccine go to healthy 25 to 64-year-olds, and then finally to those over age 65 who appear to have some immunity to this virus.
The H1N1 outbreak so far has, to a large extent, spared that population.
The big unknown, will people be willing to get this new vaccine? Even with the seasonal flu, only about 40% of Americans get the shot. Bulk doses of this new vaccine will contain the controversial preservative thimerosal, which some people claim contributes to autism, despite exhaustive studies that show otherwise. But infectious disease specialists insist it is critical to get high-risk groups protected.
Once the virus actually hits and we get a lot of illness, all of a sudden there will be a huge interest in vaccine.
Now, that's a vaccine that may only be effective after 2 doses. The federal government hopes to have 120 million doses of this vaccine on hand by mid-October, about the start of the flu season, and then 80 million doses a month after that. But Elizabeth, we learned today that there's a good chance that timetable will slip.
All right, Lisa Stark, thanks so much tonight. Our medical editor, Dr. Tim Johnson, joins us now. And Tim, we just heard there are 160 million people on the priority list, but only enough full doses for about 60 million people. That leaves a lot of people unprotected.
Well, so much depends, Elizabeth, on what we learn during the testing during the next 2 months. It's going to be tested at 2 different levels of strength, each of those different levels with 1 or 2 doses. We may learn that a single dose is sufficient for some people. Usually you need 2 doses when you're producing a new strain vaccine in young people who are being exposed for the first time. But older people who have had some previous exposure may need only a single dose. But so we've got a lot to learn about the dosing.
Is there a concern, though, that so many people on that priority list will not be first in line, and in fact will have to wait?
There is a concern, especially if we have to do 2 doses in everyone. So we need to remind people that there are other strategies to prevent getting the flu, washing hands, avoiding coughing, sneezing, etc., that are almost as important as the vaccine. It's not just the vaccine. These other strategies are very helpful. And
Tim, how certain can people be that this vaccine is safe, given the rush to get it made and distributed?
That's going to be a prime question. We remember the 1976 swine flu vaccine problem. So testing for safety is going to be critical, and the government will have to assure us that they've tested adequately and there are no real serious side effects.
All right, Tim Johnson, thanks so much.